Hi, I'm Dr. Ed Jacobs, founder of Impact Therapy, here with Dr. Chris Schimmel. And we're going to talk about one concept in Impact Therapy, which is an active, creative approach to counseling. And this idea is called in face behind you, where when somebody has an issue, such as they can't get over their divorce, a rape, or whatever it might be, and you put it in front of them
on the piece of paper.
Yeah, write divorce. Like, let's say I write the word divorce. And then I say, how many fingers do I have up? What do you see going on?
I can't see anything.
What do you see?
Divorce.
And that was 10 years ago was your divorce. Where does that belong, Chris? You know where? Well, down there or behind you.
Behind
me. And it's just a good concept of thinking what counselors are trying to do is help people get it behind them. Kristen, why don't you tell that story?
When I was working as a high school counselor, I had a young man come to me, 17 years old, and 10 years prior to our work together, when he was 7, his father murdered his mother as he and his sister were sleeping down the hall, and they heard some commotion, and when they came out into the hallway, the father told them to go back to bed, and as it turns out, he had indeed, murdered their mother. So my client had a lot of guilt, and he lived every day with mom's murder just right in front of him. So I took a piece of paper and I wrote mom's murder on it, and I had him hold it, and I said, how many fingers am I holding up? And right. And I would say, look, my job as the counselor is to help you do this, and then how many fingers am I holding up?
3.
You can see that now, right? And really, our work together eventually is to help get this behind you. And we did work on, I used REBT to help him with his guilt, because he had the sentence in his head that somehow a 7-year-old should have saved her. And so those of you who are familiar with REBT, or you're watching the YouTube clips on Impact Therapy and you're becoming increasingly more aware of the use of REBT, that was a very helpful theory in helping him understand that it was not a 7-year-old's responsibility to save his mother. But this technique of having him physically take that and put it behind him was very powerful. And he actually made the comment to me as we finished our work together, why in 10 years and 4 or 5 other counselors hasn't anybody ever said to me it's okay to put this behind you? And that was really powerful for me as a therapist.
For more information, go to impacttherapy.com.